A single hospital visit in Singapore, and the bill is almost $13,000. Not for surgery, not ICU, just regular treatment for a rare disease, and the biggest cost is one medication alone. A 46-year-old Singaporean patient, Madam Haslina Wana, has gone viral after sharing her medical bills on Facebook, showing the steep reality of living long-term with a rare condition. In her post on the 15th of January, she shared photos of her bills and made a sharp, heartbreaking joke that her medicines could buy her luxury designer bags, like Chanel or Hermes, and asked if anyone wanted to trade. But behind the humor is a serious message. Rare disease treatment is not just expensive, it can be life-defining. Her bill showed a total of $12,793.62 payable, after $1,151.43 in government subsidies and GST offsets. And here's the shocking part. The biggest chunk of the bill, more than $10,000, went to a single medicine, epoprostenol, also known as Velitri. It's an infusion used to treat pulmonary arterial hypertension, a serious condition involving the lungs and heart. Other items in the bill included tadalafil tablets, courier services, and several smaller charges that add up over time. Madam Haslina shared that she was first diagnosed back in 2008 with scleroderma, a rare autoimmune disease that causes hardening and tightening of the skin. Over the years, she went through multiple procedures. In 2013, she even underwent a stem cell transplant to slow down the progression of the disease. But by then, she said the treatment came late, and her condition had already advanced into another rare issue, pulmonary arterial hypertension, a rare heart-related condition. What made it more dramatic is that this second condition was discovered by accident during pre-treatment checks for her transplant. Since then, she has been living with both conditions, and her routine involves long-term medical support. She shared that she attends palliative care at a CC daycare center and visits clinics at the National Heart Centre Singapore every 3 to 6 months. Now, this is where her message becomes especially important. Madam Haslina said her medication and oxygen therapy are extremely costly, but she is thankful that her medications and consultations are covered under Medifund. However, she pointed out a key gap: oxygen tanks are not covered by subsidies. And as someone who uses oxygen heavily, she said she was shocked when she first saw how high the bills could climb. But she also shared something many people don't talk about: how important it is for healthcare workers to warn patients early. She said she was informed in advance about the costs and about the assistance available, which helped her prepare mentally and financially. And her story has now brought attention to the bigger picture. In Singapore, patients with chronic or rare conditions may qualify for support schemes like MediSave, MediShield Life, Medifund, and CHAS. These can help cover medication, specialist outpatient visits, and other key healthcare needs. Medifund, in particular, acts as a last safety net for Singaporeans who still struggle with remaining bills even after subsidies, insurance claims, and MediSave use. Madam Haslina ended with a message many families in Singapore need to hear. She said she is grateful to be here because there are many subsidies available and medical assistance exists to reduce the burden. Her advice was simple: talk to your medical social worker. So here's the big question for all of us. When healthcare costs can reach 5 figures for a single visit, are we doing enough to make long-term treatment sustainable, especially for rare disease patients? If you found this story important, hit like, share, and subscribe to 2230, because we cover the issues that affect real lives in Singapore every single day.